The fifth leading cause of cancer in women in the United States. September is Ovarian Cancer Awareness Month, and a St. Louis nonprofit is leading the way. Susan Robins is the executive director of St. Louis Ovarian Cancer Awareness. She's with us this morning with more on what they're doing this month. Good morning to you.
Good morning.
Yeah.
Thank you for having me.
Absolutely. First off, how common is ovarian cancer in the St. Louis area?
There's about 250 cases diagnosed annually in the St. Louis area, and about 450 diagnosed in the state of Missouri.
What are some symptoms of ovarian cancer?
Well, the symptoms are similar to gastro symptoms: feeling full quickly, abdominal pain, urinary frequency, and bloating. So women tend to kind of dismiss them and ignore them for sometimes far too long before they'll bring them up to a physician or mention that. I was actually diagnosed when I was very young, 23 years old. I had every symptom, and it really was 3 or 4 months before someone really thought it could be a gynecologic issue.
Yeah, you just don't think that.
No.
Just not the first thing that comes to mind.
Right.
With awareness this month,
Right.
is early detection one of the things that you're really trying to get out there?
Certainly, because knowing the symptoms really gives you the information you would need to pass on to a healthcare professional, especially if they're chronic. There is no diagnostic test, so the Pap smear does not screen for ovarian cancer. So it's very important, there's not a mammogram, there's nothing that's going to alert you. Knowing a family history, if you do have a family history of ovarian cancer and breast cancer, there could potentially be a genetic component in your family that you may not know about, but should be aware of.
So know your history. Any other
Correct.
personal risk factors?
Really, that's it. The family history and the personal symptoms that you're experiencing that are chronic and just don't go away.
Is there anything that we can do right now?
Just knowing the symptoms.
Knowing them.
Really, and spreading awareness. And if you have other women in your lives who are complaining about bloating and it's just not going away or something, just check it out.
Yeah, absolutely. And Susan, you have a lot of events coming up
Yes.
for us this month and even one into October.
Yes, this is the month that we try to really raise awareness. Sometimes this is a disease that falls under the radar, so we try to teal up St. Louis as best that we can. That's our cancer ribbon color. We have an event at a nail spa, Teal Toes, and many survivors attend that event. Caregivers, healthcare professionals, and they'll have their teal pedicures and just spread the teal throughout St. Louis. It all leads up to our annual run walk in October, and we have almost 1,500 individuals, pets, kids, all kind of there to provide community support for women battling ovarian cancer and raising awareness of the disease.
All right, a lot of stuff coming up you can get involved with. Susan Robins, thank you so much for being with us this morning. We appreciate it.
Thank you.
All right, we'll take a break and we'll be back.